Weight gain, depression, fatigue, decreased sex drive, these are all symptoms of low testosterone. If they describe you, there is help out there. Joining me now is Dr. Russell Bartels from Vitality Bioidentical Hormones. It's good to see you. Thanks.
It's good to see you.
Joining us this morning.
Thank you very much.
I mentioned some of those things. You know, a lot of people say, yeah, of course I have that, and they just kind of think that's just what happens as you get older, but you're saying it doesn't
one of
have
the
to be that
things,
way.
and I'm sure you've heard this before, I'm tired of feeling sick and tired.
Right.
And that's a common scenario in both men and women that it's different for different people what they mean by that, but they've usually, by the time they've come to see me, they've seen maybe several other providers looking into these problems. Maybe it's fatigue, maybe it's arthritis, pains and aches, it's hot flashes, night sweats, decreased sex drive, and the list that we went over, and many more symptoms. But they've had an evaluation, they've had blood work done, and at the end of the evaluation, it's, you know what, you're normal. Everything came back normal. And, I guess when normal is not good enough and you're not happy with that answer, or you're told it's just part of the aging process,
sure.
I never want to tell that to a patient. I want to see if we can do something more. And by treating with hormonal supplementation, bioidentical hormones, both testosterone, estrogen, progesterone, thyroid, checking vitamin levels, we can make people feel a lot better.
Is that because when patients go to their regular doctors and they're told everything's normal, they're not looking at the whole picture? Is that part of the problem?
It might not be the whole picture, or just even interpreting those values. Some things you do want in a normal value. Sometimes you would probably feel better if you were at this end of the spectrum instead of that end of the spectrum. Okay. And so I kind of look at those levels, if they've already been done, or we'll draw things that haven't been done and look a little bit deeper and maybe optimize. Maybe it's just, hey, you know what, it's normal for your age. Well, you know what, we can do better than that. And testosterone, okay, is a very powerful hormone for men and women, okay?
Sure.
And it's something that we find low in men. Most of the women are going to be in the normal range, but we can optimize. But we do find it very low in men where they've been told it's normal, and we can optimize it. And there's different ways of optimizing that. And some people are familiar with creams that you can apply.
Sure.
We do creams. We can do injections. Predominantly what we do is pellets that go under the skin. They're very small, and they're placed usually off of the hip, buttock area. And they last for women 3 to 4 months, and for men 4 to 6 months on average. And they're the most physiologic way of putting hormones back into your body, because your body can actually self-regulate.
Takes what it needs
when it needs it, and you can't duplicate that with creams and injections and patches and oral formulations.
Gotcha.
And what we're finding is that this is, when medically necessary, covered very well by insurance companies. And a lot of people might have heard of this type of therapy and thought it wasn't an insurance type thing. Well, we are seeing great coverage by insurance companies when you have a medical problem.
Because you said this can help with certain medical. We have a kind of a sheet here of things that people come to you with, and it's like, actually this can be treated by hormones too. Things
absolutely.
like
all those conditions listed on the screen right there, and it's amazing how with hormones we're treating conditions maybe better than some other specialties, for migraines, for arthritis, aches and pains, and I encourage those other specialties to look into the benefits of testosterone. But when you're on a list of medications this long and still not feeling well, I think it's time to reevaluate where you're at and what we can do with a hormone that your body naturally produces, and get it back to you and get it to the levels that are optimal. And it's really been very satisfying seeing patients come in and seeing them, a month or 5 weeks into treatment, and almost seeing a new person in front of you.
Wow.
And it's very rare that patients stop doing this therapy because they do feel good.
And that's the route you want to start with, not try all this other stuff and be on all this medication, when it can be something almost as simple as just regulating your
you see a lot of commercials on TV for all these medications, then you hear at the end all these side effects. We don't really have many side effects with testosterone. And there's a lot of commercials bringing awareness about testosterone deficiency, which is good to raise awareness, but a lot of the products that are being promoted, supplements to raise your testosterone by 20%. Well, if you start at a level for a guy, for instance, at 200, that's very low. If you go to 240, a 20% increase, are you really doing anything? Right. And so we really encourage patients to come in, get an evaluation, and actually do it as a couple. I mean, if there is a couple or an individual, but in a relationship, you both want to be on the same page.
Sure.
And we do a lot of consultations with husband, wife, boyfriend, girlfriend to kind of get them both on the same page.
Very good. I love it. So now you know where to go and to get better and feel better. Thank you very much for telling us about all this. So if you want more information about Vitality Bioidentical Hormones, you can visit vitalityhormones.com or call the number right there on your screen.